Hi, I'm Jamie. I am an advocate for newborn screening after my son had an out-of-range newborn screening result. Having my son identified at birth gave him the opportunity for early treatment, and I want to make sure that all babies have the opportunity to be identified at birth. I wanted to become involved in newborn screening, but was unsure of where to start. Newborn screening identifies conditions that can affect a child's long-term health or survival. Early detection, diagnosis, and intervention can prevent death or disability and enable children to reach their full potential. One of the first things I realized is that newborn screening is so much more than a screen for rare conditions at birth. It is an entire organization of care involving many people. It is important that families are involved at every level. First, let's talk about why we might want to be more involved. It is important for families to understand newborn screening. Although nearly all babies born in the U.S. every year receive newborn screening, only about 2 out of 3 people are aware of newborn screening. And only about 1 out of 3 people can correctly identify a definition of newborn screening. You might want to get involved to raise awareness for newborn screening or to drive change that you think it is important. In the past, family advocates have played an important role in improving the experience families have with the newborn screening process and with advocating for new conditions to be added. Getting involved in newborn screening can fit the time commitment, goals, and interests we have. Let's talk about a few of specific examples of how we can lead within our local community, your state, and even at a national level. When I wanted to be involved, I started by learning more about newborn screening as a system. I checked out resources like online learning modules, educational videos, and websites. I also started attending webinars and conferences with other newborn screening experts. I connected with other parent leaders and advocacy organizations to understand the groups involved in newborn screening. One of the best ways to get involved is to share our stories. We can do this on social media, in parent support groups, at community events, and with other family leaders. Groups are available at local, regional, and national levels. Another way to get involved is to research your state newborn screening department. You can find your state's newborn screening website by visiting the Babies First Test website and clicking on Conditions Screened by State. Find your state and follow the link to your state's website. Take a look at your states and look for opportunities to volunteer. My state even has an advisory committee I was able to join. I've also attended public meetings in my state. There is always a need for advocates like us to get involved at the local, state, and national level. Find an area that interests you and let your passion for change lead the way. These are just a few examples of ways to get more involved. How do you plan to get involved? If you need help finding more organizations to get involved, please contact Expecting Health. This organization will be happy to help connect you.